think that as much as cataract surgeons would like to, if possible, avoid vitreous at all costs, there just isn't in reality the situation where you may not encounter vitreous. So it can happen just iatrogenically during your surgery, but it could also happen because you have a complex surgery you didn't really recognize had zonulopathy or the potential for the need for a vitrectomy. And then, of course, we have our patients who come who have dislocated lenses, or we know in advance we're going to need to do a vitrectomy. So even in the cataract surgeon who just doesn't want to get involved in vitreous, there's just really no practical way to believe you would never need to do a vitrectomy.
Right. I think that the vitreous is no man's land for most cataract surgeons, but having more interaction and more overlap between cataract surgeons and retinovitreal surgeons, that's their happy place. So they can help us kind of confront our fears and understand that we can manage vitreous, and we can work with them. And sometimes that helps the patient have the best outcome.
Yeah, and I think the other thing is we're learning that so much of vision quality, so our quality of vision for our premium patients especially, has to do with the whole optical palette.
Absolutely.
So we've concentrated a lot on the ocular surface. We know how important the lens is, but now we also understand the opacities within the vitreous are important as well. And because of that, I think we're going to be concentrating more on making sure that that's a clear pathway.
Yes, I'm sure it happens often for you where I'll be discussing cataract surgery with a patient, discussing premium IOLs or trifocal IOLs, and they say, well, what about this floater? Will that be gone after my cataract surgery? And I say, probably not. Sometimes patients seem to feel that their floaters are better. I can't take credit for it, but I'm happy when that happens. But most likely it will still be there. And that's just the facts of the matter. That's kind of the way that we approach the vitreous with cataract surgery, is we try not to touch it. But that may not always be the best way.
And a lot of times especially as there's consolidation within practices, now in the United States, many are multi-specialty practices. And in our ASC, although we never had retina doctors operating, we do now. And so the ability to have one machine that does two different tasks that can rotate, depending on what the needs are for that particular OR that day, that will be a real advantage for us in our ASC and not having to buy redundant equipment.
And the space itself, our ORs are fortunately fairly large, but when we open up a case that is going to be a combined cataract and vitrectomy case, the entire periphery of the room is taken up by the machines. There's 2 back tables, 2 Mayo stands. So it really fills up the space. Everything's cords everywhere. So having one unit with a smaller footprint will, allow that to happen in more centers and more comfortably.
Yeah, and I think there's the capital cost too. So if you're buying 2 separate machines, that's 2 different capital costs. One, it might not be actually used all that much, depending on how much retina you're doing in your center. And the other that can be more of a workhorse. But if you can combine that into one machine, I think that's better financially as well. I mean, for me, I want my vitrectomy to be as sophisticated as my phaco portion of the cataract surgery, which we're used to just having the best technology to be most efficient with the cataract extraction. But we want that same high level of efficacy and efficiency within the phaco or the vitrectomy portion of it as well.
Absolutely. And I think we want to be able to address all of the patient's complaints. We are understanding more now as cataract and anterior segment specialists, for example, the importance of the ocular surface when you're implanting advanced technology lens implants. But, we stop. It's a hard stop when we don't talk about anything. We don't address anything behind the posterior capsule. But we understand now that the vitreous is a really important component of the visual system. And we sometimes cross our fingers and hope that it won't be a problem after surgery, but sometimes the ocular surface can be perfect and the implant can be perfect and the refractive outcome can be perfect, but the vision isn't perfect because of issues in the vitreous. So if we had a way to expand and really address all of those things at once, I think that could really enhance our patient satisfaction in some of those cases.
And even if you're deciding to do a combined case with a specialist or posterior segment and you're not comfortable there, not having to bring in new equipment and reset up the room is an advantage. And so, and, better for the patients. Yeah, I think we always want to make sure that whatever technology we bring in, which we often bring in new technology that we think this is so cool for the surgeon, it's so cool for the patient, and then the staff that has to set it up and run it are like, this is the most ridiculous interface I've ever seen. This is so hard to set up. It takes so much time. It's not easy. It breaks down. We don't know how to fix it. So having staff have input on the design and the function of something, which again is a nice way of partnering with smaller companies, is critical to success. Yeah. So it's a critical component to know how they're going to be able to interact with it.
Yeah, and I think it's one of those things where the demand kind of breeds the innovation. So as we do understand more about how these things affect the refractive outcomes or the patient satisfaction outcomes, it starts to provide the incentive to how can we solve those problems? How can we make the process a little bit more integrated and seamless and not have a complete changeover in the operating room, or even in some scenarios would have to be a 2-stage procedure if a patient needs a cataract and a vitrectomy. I'm also in a different day, right? Exactly. I'm also in a practice setting where I can do it all in one fell swoop, myself doing the cataract and typically a vitreoretinal surgeon taking over and doing the vitrectomy. And we do have the capacity to do it all in one sitting, one anesthesia event, which that's important for patients as well. Anesthesia is not a net neutral event. There are side effects from it. Patients feel that. So to be able to really seamlessly smooth that process, I think is going to just be better for everybody, from the patients to the staff to the surgeons and everybody in between.
I think anytime we have new technology, there's a learning point. And, we want to make sure everybody has sort of a vested interest, or at least understands what the benefit is, or that they can feel like, yes, it's worth the extra effort to learn something new, and that the change is important to embrace. And then there's always, the financial part of it. If you're replacing something that we already have that's functioning, there needs to be something that we can demonstrate that helps with efficacy,
right,
or helps with efficiency, or some added benefit that helps to motivate us to make that change.
Right. Yeah. Identifying those pain points, those inefficiencies, those little lurches and fits and starts as you're trying to get through the case or the process, I think is where an integrated system would really fit in nicely.
Can't wait really to have more phaco-vitrectomy units, because when you have a complicated case, either there's one that going into it, and I happen to do a lot of dislocated or complicated cataracts, having all of the tools that I would need on the vitreous side, which for me is obviously not as comfortable side as taking a lens out, which I do more commonly, that would be lovely. So, it'd be wonderful to feel like I have the very best for that side of it, instead of something that's maybe, a second thought.
Right. Well, it's hard to dabble in things. So if you're only using equipment occasionally, you're uncomfortable with it. Everybody who's handling the different pieces and parts is a little bit uncomfortable with it. So when you're using something often and you're comfortable with the system and the capabilities of it, I think that would just help the entire process as well.